I am Dr. Jyoti Mayadev.
And I am Dr. Brandon Dyer.
And we are physicians who specialize in brachytherapy. Brachytherapy is the direct application of radiation sources close to a tumor. In this video, we will spend time reviewing the general principles of brachytherapy and how it will be helpful in your treatment process. Additionally, we will review the treatment process, potential side effects, risks and benefits, and expected clinical follow-up after your brachytherapy procedure.
Brachytherapy allows for additional radiation dose delivered to the tumor by itself, or usually in combination with external beam radiation. Depending on your type of tumor or the tumor response during external beam radiation will determine the timing of the brachytherapy procedures. Often, they occur towards the end of the external beam radiation.
Usually, after a course of external beam radiation, you would be a candidate for brachytherapy. This would include an applicator that is placed in and around where the tumor is located. Depending on the size and location of the tumor, various applicators could be used.
We will now discuss the various applicators that would be used in your brachytherapy implant. Based on the type of tumor, size of the tumor, and tumor cell histology, different types of brachytherapy applicators may be preferred. There are multiple types of brachytherapy applicator models that can be used alone or in combination to optimally deliver radiation dose to the tumor while simultaneously sparing other tissues. We will now review some basic human anatomy to help you visualize the areas being treated and the different types of brachytherapy devices used to treat tumors in each of these locations.
We will now focus on your normal pelvic anatomy to help you better understand your radiation implantation. In the normal anatomy, we have your bladder, rectum, vagina, cervix, uterus, tubes, ovaries, and small bowel that often drapes on top of the uterus or can even fall between the posterior portion of the uterus and the anterior portion of the rectum. For example, after surgery for endometrial cancer, the vaginal cuff, where the vagina was sewn back together, is treated with a cylinder to treat the top of the vagina, the area at highest risk after surgery. To decrease radiation dose to tissues surrounding the tumor, such as your bladder, rectum, or bowel, and to optimize your radiation dose delivery, we may need to augment the radiation using additional hollow tubes that go into and around the tumor.
Depending on the size, location, and local tumor extension, different types of cervical applicators may be used. The physician will perform an examination and place the applicators with the help of physical examination or using ultrasound devices.
The most common type of applicator used in the treatment of cervical cancer is the tandem and ring, or tandem and ovoid. These applicators can be used interchangeably and provide equivalent radiation dose to the tumor and normal anatomic structures. Applicator selection largely depends on physician preference. There are 3 to 5 treatments requiring a device insertion for each subsequent treatment. Following the completion of radiation treatment, the applicator is then removed.
Here is an example of a tandem and ring, which is typically used in the treatment of cervical cancer. We can see the tandem, which is inserted first through the cervical os and into the uterus. Next, the ring is inserted into the vagina, with the ring portion lassoing the cervix and providing dose to the cervix and the adjacent parametrial tissues. Last, a rectal retractor is placed, which helps reduce dose to the anterior rectum and decrease toxicity. For larger tumors, tumors that extend to the pelvic sidewall or into adjacent organs, it is often necessary to manipulate the radiation dose to improve tumor coverage or to spare radiation dose to normal tissues. This is accomplished with a needle supplementation to a tandem and ring or a tandem and ovoid implantation. These needles can be placed directly into or adjacent to the tumor, either through the vagina or through the perineal tissues, and allow for fine-tuning of the radiation dose.
Here is an example of some applicators that are used for a GYN interstitial implantation. We can see the cylinder, which is often used in the vagina, a tandem, which carries radiation dose to the cervix and uterus, a vaginal sleeve, which is often employed to decrease dose to the vaginal surface, a flexible needle, which can be used lateral to the cylinder or to supplement dose to the cervix, uterus, and perimetrial tissues as needed. Often, in addition to flexible needles, the use of straight titanium needles may also be used and helpful in specific cases. Sometimes, to achieve optimal tumor dose coverage, a tandem and ring or tandem and ovoid would be insufficient. In these cases, a tandem and cylinder with needles could be used with additional needle supplementation through either a vaginal or perineal approach. There are typically 3 to 5 treatments. Sometimes each treatment requires a device insertion. In other cases, a single or several implantations are performed, and you may be hospitalized during this process. Your radiation oncologist will review the specifics with you regarding this type of treatment, often referred to as interstitial brachytherapy. Similar to the tandem and ring or tandem and ovoid, which is used to treat cervical cancer, a type of applicator called a Y applicator is used to treat endometrial cancer in patients unable to undergo surgical resection. The Y applicator is inserted through the cervix and then into the uterus. There are typically 3 to 4 treatments requiring a device insertion for each treatment. Following the completion of each treatment, the applicator is then removed. For patients with endometrial cancer who require surgery and then require radiation, a simple cylinder can be used. Occasionally, needle supplementation is also used with this technique when appropriate. There are typically 3 treatments requiring device insertion for each treatment. Following the completion of each radiation treatment, the applicator is then removed. Your radiation oncologist will discuss this information with you and decide on the optimal type of brachytherapy applicator, dosing, size, and treatment number.
Prior to implantation of any of the brachytherapy devices we just discussed, your radiation care team will sterilize the treatment area to prevent infection. A Foley catheter may be placed in the bladder to aid the physician with the treatment planning process and for your comfort. You will be given pain and nausea medication if necessary to make you as comfortable as possible.
We will now discuss the risks associated with the procedure. To ensure your comfort and a successful and optimal brachytherapy implantation, anesthesia, which is a reduction of procedural pain, is usually used.
Seizure, abnormal heart rhythm, bleeding, bruising, headache, injection site pain, no pain relief or worsened pain, infection, temporary or permanent nerve damage, temporary or permanent paralysis, temporary or persistent mood changes, trouble sleeping, temporary or persistent hallucinations, confusion, impaired senses, meaning disorientation and confusion, impaired judgment, impaired motor coordination, mood or emotional changes, including exaggerated sense of well-being, euphoria, and psychosis, spastic jerking movements, increased muscle tone, muscular tremors, reduced clarity of awareness of the environment, psychological disconnection from the surroundings, high or low blood pressure, amnesia, loss of emotional control, depression, fatal respiratory problems, allergic or life-threatening anaphylactic reactions, less common temporary or permanent medication side effects, other less common temporary or permanent neurological complications, and death.
Nausea, abdominal discomfort, abdominal pain, loose stools, blood in the stool, rectal urgency, rectal narrowing, ulceration, rectal fistula requiring surgery, rectal bleeding, decreased blood counts, diarrhea, change in bowel habits, bladder irritation causing urgency, frequency, burning with urination, bladder infection, bladder inflammation, decreased bladder capacity, blood in the urine, vaginal irritation, vaginal narrowing, vaginal shortening, vaginal dryness, pain with intercourse, vaginal bleeding or spotting, vaginal bleeding after intercourse, vaginal discharge, vaginal tissue necrosis, vaginal fistula requiring surgery, skin redness or tanning or breakdown, skin itching, irritation, tenderness or pain, skin swelling, loss of pubic hair, fatigue, pelvic fracture, nerve damage, or leg swelling. As a woman, if you are of childbearing potential, you must use an adequate form of contraception prior to and during radiation. If you are pregnant, you may not undergo radiation, and if you become pregnant, the radiation will be discontinued. If you become pregnant, you must notify your doctor immediately.
If you are a premenopausal woman, the brachytherapy form of radiation will render your ovaries non-functional, and you will become postmenopausal. You may need to take medication due to this process after the radiation therapy has been prescribed by your doctor.
You will not be able to become pregnant after the radiation due to the radiation effect on your ovaries. The radiation to the uterus will not allow expansion for childbirth, and therefore you will be unable to carry a child to term, and you cannot be a surrogate mother.
We have discussed a lot of the risks, but the goal of the brachytherapy procedure is to help you with your disease process, and with careful brachytherapy technique and attention, your side effects can be reduced. We specialize in gynecologic brachytherapy, and our utmost goal and concern is your health and safety. After your brachytherapy procedure, you will continue to follow up with your radiation oncologist and your oncology treatment team.
We will now focus on what to expect for the procedure. This will be reviewed in greater detail by your nurse. As part of the pre-procedure preparation, you may be asked to induce a bowel movement or poop prior to your procedure to help reduce the risk of infection and toxicity. If this is necessary, you will be given special instruction in this regard. After the applicator is placed for the brachytherapy, you will receive a CT or MRI scan, depending on your tumor type and the physician's preference, to best target your tumor. This scan is used to plan the delivery of radiation therapy.
After the brachytherapy implantation and imaging, your physician will generate a custom plan to target and kill the tumor based on your unique individual anatomy. This process includes generating target and avoidance structures that are based on your own unique bladder, rectum, vaginal, tumor, and bowel anatomy. To ensure the highest possible plan quality and safety, a certified radiation physicist will then verify or generate a portion of the treatment plan to confirm that your treatment is safe and deliverable. They will also confirm the radiation dose calculations and the machine readiness with a series of checklists. This process is repeated for each implantation so that optimal tumor dose delivery and normal tissue sparing can be achieved.
Once your physician has finalized your brachytherapy plan, you will be transported to a procedure room where you will be continuously monitored using voice and video surveillance. This helps ensure your safety and comfort during the delivery of radiation. A brachytherapy radiation source will be connected to your implanted brachytherapy applicators, and the physician and radiation physicist will check the radiation tubing connections for security. There will be an initial test run that does not deliver any radiation, but confirms that all the connections are secure, and the treatment plan has been successfully loaded into the computer, and that the machine is successfully communicating for that treatment plan. Once we have confirmed that all components are working as expected, the real radiation treatment will begin and will be delivered as planned. After the successful delivery of your radiation treatment, your applicators will be removed. If your treatment plan involves an overnight stay in the hospital, you will be safely transported back to the hospital with the applicators to stay in place for subsequent treatment the next day. However, usually the applicator will be removed following the completion of treatment. After your procedure, you will be continued to be monitored. Once your physician or team has determined that it is safe for you to go home, you will be discharged with special instructions and medical contact information should you have questions or concerns that arise after your discharge home. In general, you need to talk to your physician's office immediately after the procedure if you have any fever, chills, vaginal bleeding that soaks several pads, or pain that does not resolve with your pain medications.
We will plan on seeing you back for clinical follow-up after completion of your brachytherapy procedure.
We hope that this video has been educational and has answered some of your questions that you have surrounding your brachytherapy implantation and how it is incorporated into your overall treatment goals. If you have additional questions, please direct them to your radiation oncology physician. Together, we can ensure that your brachytherapy implantation is optimal and safe.